So this study was conducted in the observational study of the Women's Health Initiative, which originally entered over 93,000 women between the ages of 50 and 79 years old from 1993 to 1998. There's not an intervention, so it's an observational study. These women were subsequently followed for a number of years. And what we did is body weight and body mass index was determined at baseline and year 3. Additionally, at year 3, we asked them if they gained or lost more than 5% of their body weight in the last 2 years, and was it voluntary or involuntary. When we left out a number of women who had cancer to enter or had missing values, we're left with 63,105 participants who were following for 11.4 years after the 3-year determination. We prospectively identified 3 categories, which was stable weight, less than a 5% increase or decrease over the 3 years, weight loss, again, more than 5%, and weight gain more than 5%. So we prospectively had those 3 categories. Breast cancers were all prospectively reviewed by pathology reports and medical records. The major finding was that after 11.4 years of follow-up, women who had lost greater than 5% of the body weight was associated with a 12% lower breast cancer incidence, which was statistically significant. Weight gain group overall didn't increase their breast cancer incidence. However, triple negative breast cancers were significantly increased in that population. When we looked at by weight loss intentionality, that really didn't make a difference. Now, it's interesting that the women in the weight loss group were actually, compared to the women who had stable weight, they were heavier and less physically active. And their body mass index at baseline was 29.9. So they were on the verge of being obese. And we wonder in retrospect whether that was some kind of motivating factor for the group. Those are the major findings. So it reflected about 15% of the overall population. And I guess I don't know whether that's bigger than expected or smaller than expected, but that was a substantial percentage of the population who, one way or another, lost weight. I think that's doubly encouraging in a certain sense, because almost very few of those women really would have gotten into formal kind of programs for weight loss. And so that's something that you kind of independently initiate and complete. And the second thing was, you don't have to get to a normal kind of weight. You're not going to get to a normal body weight when you start at about 30, with the 5% weight loss. So there's health benefits as we'd seen before for diabetes, other diseases, and now we can probably add breast cancer to the list. And I think for many women that's a motivating factor, because that's more on the mind of women as something they want to avoid than, say, diabetes. I think the Medicare, FDA have clear guidelines for deciding when something works. It doesn't work. It doesn't appear that they have clear guidelines in this area, or someone with money to support such an indication. So I think that those are the 2 factors. I think the regulatory system isn't prepared to evaluate, doesn't have clear criterion to evaluate these things, and then you need money to actually push something through, and there isn't big money to support pushing it through. So I think some of the analyses were actually going to be, they trigger some analyses, but they'll probably be done in another WHI population. So in the Women's Health Initiative dietary modification trial, where we have a randomized kind of trial, where we're doing dietary fat intake reduction, which was associated with about a comparable degree of weight loss, where we reported it at ASCO last year and then in JCO, that there was a statistically significant reduction in deaths after breast cancer. So what we're going to be doing, we'll be looking at, we have baseline in year 1, and we'll be looking at 2 things. We're going to be looking at, we have the metabolic syndrome on everybody at baseline, and we'll see if the metabolic syndrome gives a bigger target and be more likely to show benefit. And then downstream, we're looking for money to be able to look at potential mediators, which would be insulin resistance, components of the metabolic syndrome, blood pressure, visit-to-visit variability in blood pressure, and then additionally inflammatory factors. So that application is pending, but the metabolic syndrome thing is going forward. Maybe we'll have it for ASCO.